In regards to treatment plans, this is what I have found gets the best results for clients. So the first thing is that if the client does not have, if they have a lot of dead skin cell buildup, if they haven't done a series of chemical peels, I highly recommend that all clients start with chemical peels first before they go into microneedling. There's two reasons for this. One, once more skin is moved out of the way, the numbing is going to drop deeper into the tissues and they're going to get more numb, allowing you to do a more aggressive treatment. Two, the other reason why you want to do chemical peels first is on all handheld microneedling devices, the needles only go between 2 and 2.5 millimeters max. So if you have layers of dead skin cell buildup, it's preventing the needle from going down into the dermis as deeply as it could. So again, I like to do the chemical peels followed by microneedling. I don't like to go chemical peel needling. I like to get my chemical peels out of the way, and then I like to do my series of microneedling. The other thing is, how many treatments should she get done? So when you're using the incorrect method of dragging the pen, you do end up having to do more treatments. You end up doing like 4 to 6 because again, the needle is not getting down into the dermis. So therefore you're not getting the remodeling. You are not getting the remodeling of the tissues like you are when you're doing the touch and release method. Whereas with the touch and release method, because it is going down into that dermis, what my recommendation is you only do 3 to 4 treatments. The reason for this is it does take 6 to 8 months to get your final results with microneedling. Bitch.
It does take 3 to 4 months.
Yeah. It does take 6 to 8 months to get your final results with microneedling. The older you are, the longer it takes due to the wound healing response slowing down. And so because of this, what I recommend is you do 3 to 4 treatments. You allow the skin to heal. You wait 6 months, and then at the 6-month mark, then the client can decide whether or not they want to do another series again. It's much easier for the client to be able to swallow being told $250, $300 for a treatment and only needing 3 to 4 of them in the beginning, rather than being like, you need 4 to 6 and they're $250, $300 a piece. So again, what I like to do is chemical peels, and then I like to do 3 to 4 microneedling treatments, wait 6 months, and then at the 6-month mark, find out if the client wants to go ahead and do another series of 2 to 3, 3 to 4, whatever your thoughts are. In regards to maintenance, is once the client gets to where they want to be, I like to see people do a microneedling treatment once or twice a year, just depending on what the budget allows. Microneedling, the beauty of it is you can do it year round. It is a procedure that I do in the summertime, whereas with chemical peels, I absolutely do not. They still want to be careful with the sun. As you know, with microneedling, it is like doing a mild chemical peel. There is some skin sloughing, but I absolutely would be happy to microneedle somebody's face in August, whereas I wouldn't touch them with a 10-foot pole with a chemical peel in August. And I lied. There's 3 reasons. The third reason is that chemical peels make your skin healthier. They've forced collagen. So one of the things I specialize in, it's why I am so big on chemical peels and microneedling, is I tend to only work with CIT, which is known as collagen induction therapy. Microneedling is collagen induction therapy, and chemical peels is collagen induction therapy. So when you do the chemical peels first, it's going to make the skin healthier. It's going to make the skin more vibrant and lively. It's going to have a better wound healing response. You're going to heal better after doing chemical peels because the skin is healthier and happier. So those are the 3 reasons why you should do chemical peels first.